Okay, thank you. And let me just see if I can share my screen. I'm actually speaking to you from a hotel room, and so I've only got one screen, so it should, let's see if we get that working. So hopefully you can see my, oops, my screen now. Right, thank you very much indeed. And my talk actually follows on quite nicely from what Laura was talking about. And the title is What You Don't See That Counts, a Peek Behind the Smoke Screen. So my interest, well, the work that I'm describing was undertaken when I was the editor-in-chief of the European Journal of Public Health, an unpaid role. And that was between 1998 and 2003. And when I was employed, as I am now, as a professor at the London School of Hygiene and Tropical Medicine. I'm also president of the British Medical Association, past president of the European Public Health Association, research director of the European Observatory, which is a partnership of governments and international agencies, and research funders from funding from a number of public funding agencies. So we know that much of the evidence that we use in policy is taken from systematic reviews and meta-analyses, and we have well-established checklists for testing the validity of the studies that we put into these things. But the difficulty with this is that you can really only assess it. They only prompt you to assess what is there in the paper that you are assessing, and you don't go beyond that. And that may mean that you miss out on seeing the whole picture. And I hope I'm going to persuade you in this presentation that we need to look a little bit more widely, although I think you've already heard that already, and particularly in the work that was mentioned on the Global Energy Balance Network and others that Gary and other colleagues we were working on some time ago. So we are well aware of the possibility of publication bias. It's a standard test within a systematic review. And the idea is that you recognize that with smaller trials, you will have more uncertainty around the effect size. And in an ideal world, if you're capturing all of the studies that have been done, this will be symmetrical. In other words, the small studies will have wider dispersion, but they will be balanced on either side. And the larger studies, which is the higher up ones on the plot on the left-hand side, they will be closer to the best estimate. And if you do see an asymmetry, you know you're missing some. But the problem arises whenever this is even less at random than it sometimes is. You know, often smaller studies are less likely to be published in journals. But if there have been a whole range of studies that have been undertaken, but some of them, many of them, most of them have been actively suppressed. And that's the story that I'm going to tell today. So we can go back to the very beginning. This is a story about the tobacco industry, hence my reference to the smoke screen. And we know that there was growing evidence of popular demand for smoke-free environments as long ago as at least 1979. And at that stage, people had very little confidence in the tobacco industry as being interested in their welfare. And the official position at that time from the industry was that epidemiological research cannot prove a causal link between exposure to tobacco smoke and disease, and particularly something the industry was concerned about in the case of passive smoking. The industry argued that the apparently increased relative risks are too small to provide any confidence. But in parallel, they secretly funded often unsuspecting epidemiologists to agree a code of good epidemiology practice, which advises discounting relative risks of less than 2. And of course, at that stage, the relative risk typically found in the studies of passive smoking that were then available were about 1.3. How convenient, with cotinine measures that are a bit bigger, but still under 2. So they also said that even if an effect can be demonstrated, it's most likely to be attributable to confounding, because a lot of this work was being done where the exposure the studies were being done in women who were either living with, married to a smoker or a non-smoker. And a lot of the work was being done to try and prove that these two groups of women were different in lots of other ways, and it wasn't just in their exposure to smoke. And they also said there's no biological evidence that secondhand smoke causes disease. So, for example, one of the statements that was made at the time, we within the industry are ignorant of any relationship between smoking and disease. Within our laboratories, no work is being conducted on biological systems. Well, how did I get involved in all of this? As a journal editor at the time, I published a paper by a Swedish professor, Rylander, and he had done a study on characteristics of women married to smokers and non-smokers. Well, as I say, what we now know as confounder studies. And there was nothing wrong with the paper in itself. It wasn't a particularly exciting paper. And then, having published it, I was told that he had undeclared links to the tobacco industry. He denied it, and a very lengthy correspondence followed. And at the same time, he sued two anti-tobacco advocates in Geneva, where by coincidence I am tonight, for libel. And when I was told about this, I went onto the UCSF database. I've worked with Stan Glantz, and so I was familiar with it. And I found 18,000 hits with his name, including a lot of evidence for the transfer of significant sums of money. So what did we find? We found that he acted as a link between a testing plant in Buffalo, situated in Germany, and Philip Morris's headquarters in Richmond, Virginia. He organized a series of symposia to convey the message to researchers and to the general public, I would quote, that the available data on the harmful effects of smoke on non-smokers was insufficient and inconclusive, notably in view of other factors susceptible of influencing their health. And this is a quote taken from a court hearing in which I and my colleagues here participated in the libel case that I mentioned earlier. He also worked with a company we've already heard about, I think, yesterday, Kansas law firm Shook, Hardy & Bacon, who are known to be at the center of the campaign to distort the evidence on passive smoking, designing the strategy and commissioning spoiler studies and lobbying. And it was also found in the court judgment that he had on at least one occasion altered his results after conferring with Philip Morris. And this is a quotation from the tobacco industry documents that we got at the time, a memo from Shook, Hardy & Bacon. Dr. Rylander prepared a brief memorandum for internal use only concerning a workshop that he had run. His major point was that he did not feel that the workshop could or would be in a position to give environmental tobacco smoke a clean bill of health. However, Dr. Rylander did believe that he could bring a healthy skepticism to the conference and some of the claims being made about environmental tobacco smoke. So this obviously resonates with the discussion that we just had about manufacturing doubt. Now, remember that at this time, the industry was saying that they were ignorant of any relationship between smoking and disease, and no work was being done in their laboratories. So back to the laboratories. In 1968, Helmut Wakeham, who was the vice president of Philip Morris, expressed concern that the industry was depending on its, quote, technical intelligence system, basically monitoring the literature to alert them to scientific developments. And the information was often available only after it had been published. Much of the research was from studies that, quote again, oriented to seeking out and highlighting the negatives associated with tobacco smoke, because by this time there were serious concerns that it was harmful. And he argued that there was a need to obtain our own facts and data in biological systems in order to avoid being surprised by information from outside sources. Quite why one would be surprised that tobacco smoke was being harmful is another question. But it was also to be able to interpret and understand the results of such studies. Now, Philip Morris wasn't the first company to be in a tobacco company to look at biological research. American Tobacco had already conducted its own research and, quote, relocated it under conditions of extreme secrecy to new research facilities. But the approach was controversial within the company. The chairman and chief executive had very serious reservations about even doing this work at all. But he was eventually convinced and agreed that research could be undertaken, quote, on a contractual basis in Europe. This presents an opportunity that is relatively lacking in risk and unattractive repercussions in this country, in the United States. Well, in 1970, a German testing institute was up for sale, and Wakeham advocated purchasing it, quote, as this is a locale where we might do some of the things we are reluctant to do in the United States. Let's face it, we're interested in evidence which we believe denies the allegation that cigarette smoking causes disease. And so what were they doing? Well, the possibilities that they considered, they could conduct research on other causes of smoking-related diseases to, quote, get the industry off the hook. Although there they thought that the prospects for a positive benefit were small. They could establish scientific witnesses who will testify on behalf of the industry, although they felt that it might not be long before such witnesses were tainted by association. And they could undertake research to discover information of direct use to the industry on the biological, psychological, and epidemiological aspects of smoking. So it was purchased, but it was purchased not by Philip Morris itself, but it was purchased on behalf of Fabrique de Tabac Réunie, based up the road here in Neuchâtel. And this was because in this way, our involvement would not be fully exposed. Now, Ragnar Rylander at this point was appointed as the coordinator, and he would, quote, officially be carried on the books as a consultant to FTR. It was a Philip Morris subsidiary and would be paid by FTR. Now, of course, you will know that there is very strict banking secrecy rules in Switzerland, even more so then than there is now. There would be no formal connection between Philip Morris and Imbefo, but any proposals for studies would be authorized by Philip Morris, with the coordinator being informed of the decision. And there was a rather complex network of payment that was undertaken through Swiss bank accounts that were essentially untraceable. So there was a culture of secrecy around this laboratory. And when we look again at the internal documents, we see that when they mentioned analyzing a new flavor formula in 1976, it said, "We may want to maintain confidentiality over the results. Therefore, thought should be given to the use of this testing plant. We're anxious to keep confidential the fact that Imbefo has done its own glycerol inhalation study." And then, in a very revealing document, I subsequently found out by asking around that hardly anyone at Philip Morris knew anything about Imbefo. I also remember hearing that on occasion, some of the results and or initial observations from some of Dr. Osborne, the Philip Morris scientific director, program, were being communicated verbally rather than in writing. All in all, it seemed as if there was an inner company within Philip Morris that conducted at least some of its investigations behind the scenes on a strict need-to-know basis. Interestingly enough, many, if not all, of these activities appear to be related in one way or other to these sensitive topics of smoking and health. And another time when a researcher in Philip Morris's Swiss Research Centre suggested that samples might be sent directly to the testing facility, he was reprimanded and told the suggested procedure is in direct conflict with our communications from the New York office. We've gone to great pains to eliminate any written contact with Imbefo, and I want to maintain this. So send it to Neuchâtel for transshipment. If you can't do that, maybe we could consider a dummy mailing address in Cologne for the receiving of samples and so on. And the executive was then requested the researcher to retrieve all copies of the original letter. So what work was it doing? Well, when we did get access to the information, there were over 800 studies on side stream smoke between 1981 and 1989. Between 1972 and 89, there were 53 publications from it. Only 16% of them mentioned tobacco in related terms, even though 95% of its work was for Philip Morris or FTR. But then that changed between 1990 and 98. 63% of the publications did concern tobacco. And in 1990, what had happened was that Philip Morris were advised that the work being undertaken could no longer be assumed to be safe from disclosure, and a precautionary review of documents was undertaken. So what were the sort of subjects that they were looking at, and what did they publish? Excuse me. So first of all, there was research on other causes of lung cancer, the confounder studies, arguing that these women who were married to smokers or non-smokers might be drinking different amounts of green tea in one case. A lot of research to cast doubt on the value of cotinine as a measure of exposure to environmental tobacco smoke, because those studies were finding a larger relative risk than just comparing the two groups of women. Research showing that cigarette additives were harmless. And then a few papers did come out suggesting that tobacco might indeed be harmful, but at that stage, one felt that perhaps this was an attempt to restore credibility. So in the 1980s, we found what they didn't publish, a lot of animal studies on the effects of side stream smoke. I won't go through all of this, but essentially what it was showing was that side stream smoke, the smoke that was coming out from the side of the cigarettes, not the what was being inhaled as one dragged on a cigarette, That was getting into a room, reacting with furnishings and so on, and was often more toxic than what was being inhaled by the smoker. And Rylander was very well aware of this. He wrote in a letter to Dom Osteen, the histology demonstrates more advanced lesions in areas which are not affected by mainstream smoke. The cornification observed in these animals has never been seen before. And then crucially, and this is really the key point in all of this, the research that was conducted by Info provided a means of identifying studies that could be commissioned to others to provide the desired results. So, quote, the result of such work has enabled us to provide accurate input as to what could be expected to be seen in the Bruin experiment and led us to recommend that he support its conduct by the German Cigarette Manufacturers Association. So essentially what was happening here was that they were doing hundreds of studies, and by manipulating the conditions in which the studies were being done, they could design an experiment which would give them the results they wanted, and then they could commission independent researchers at arm's length to do those studies, and they knew what the results would be. So in summary, where are we? Well, by the late 1960s, the tobacco industry realized it needed the capacity to conduct biological research on the health effects of tobacco. Conducting the research in the United States was too dangerous, and it had to create a complex arm's length set of relationships to keep its work secret even within the company. The communication was via a Swedish public health professor who maintained an image of independence. So my point is that it's not just the research you can see, it's what you can't see. And the importance of this is that often we are told that we should set aside all of these other considerations, and we should simply look at the quality of the science in the paper in front of us. We should not be concerned about who funded it. We should assess it on the basis of the methodology and the results as they're presented. And I would argue that this is very naive, because it's what we cannot see that is important. So just the final verdict, the libel case was lost. We got a great deal of information out on discovery. My colleagues, Pascal Detailman and Jean-Charles Riel, who were the two advocates in Geneva, who had been sued, won, and it was covered extensively in the Swiss media, and it was also covered in a book, Infiltration in French, which tells the story in which I have a walk-on part in that I walked into the court. Although I was actually described as British, I'm actually Irish. That was the one mistake, but it covers it in some detail. And if you want to read it any more, we published it all in the Lancet, and I have a QR code to the publication. And with that, I'll stop sharing my screen.